Uh, I am Mamta Bajre. I am the lead health economist and methodologist working at Oxford Academic Health Science Network. This is two of the fourth webinar Oxford Academic Health Science Network is presenting on introductions to the real world. We had last Tuesday, we had a webinar on the introduction to the real world evaluation and health economics presented by my colleague. And this is the second part of it, which is the introduction to the health economics. This session is being recorded, so you'll get the link and the slides by my colleagues. Okay, so today's agenda for this webinar is we'll go through the general concepts of health economics. We'll discuss few key evaluations we do. We'll also discuss on the applications and considerations while we conduct health economics. We will discuss some key points on the costs and benefits. We'll discuss fundings, especially which we encounter at Oxford Academic Health Science Network, economic evaluations of medical devices. This is the main area where Oxford Academic Health Science Network conducts health economics. And we'll also discuss what is early economic model, why early economic model is important, and what are the benefits of conducting early economic modeling. We'll also have some discussions around the feasibility used for the early evidence generation, which is very, very important when conducting early economic model and early economic evaluation. And next, is there any questions from you? If you have any questions, please pop it in the chat. We'll discuss all the questions after the presentations. So let's start. This webinar is to introduce the concepts of health economics and how they can be used to assess the impact of healthcare intervention. Whatever we discuss here as in health economics is not to guide a health economic model, but just to give an overview of how health economics can help demonstrate the value of the intervention and some of the key elements around it when you're thinking of any health economic analysis. Health economic analysis can be used to assess health interventions, value for money. They can support and the optimal allocation of the limited resource available in the healthcare. So what is the key issue these days? The key issue is that there is scarcity. We need lots of interventions to be implemented, lots of resource around it. However, we have limited resource, but we need unlimited interventions, unlimited benefits. So we have to find out an alternative use so we can have maximum outcome. And for health economics, of course, the cost benefit around it. The general concepts of the health economics. The general concept of the health economics is that, health economics, it's a definition you can find anywhere. It's a definition that health economics is the application of economic theory, models, and empirical techniques to the analysis of decision making by individuals, healthcare providers, and government with respect to the healthcare and health. Alternatively, you can also say that health economics is defined as the one branch of economics which deals with the provision of healthcare service, their delivery, and their use, with special attention to the quantifying the demands and the measuring outcomes of service, their social needs, their financial needs, the opportunity cost of such services, their deliveries, and the benefit obtained from it. With the health economics, you also are able to understand the societal benefit opposed to the individuals, because it's not about a person, it's about the whole society benefiting out of it. The main question is, why actually do you conduct the health economics? Well, health economics is used in evaluations to compare two or more health interventions on the basis of their cost and outcome. In the simple term, outputs of health economics evaluation can assist in determining which intervention will deliver the value for money for the healthcare system and is actually worth investing in it. There are many key evaluations. So economic evaluations is nothing, it's just primarily about evaluating the efficacy, the efficiency. There are many kinds of evaluations we actually conduct: cost minimization analysis, cost effectiveness analysis, cost utility analysis, cost consequence analysis, and cost benefit analysis. out of all those, we are actually discussing here 3 of them. One is the cost effectiveness analysis, which is generally known by all the people who understand health economics or the investors who want to do the health economics. So cost effectiveness analysis is a form of comparative economic analysis that evaluates 2 or more policy alternatives in terms of their relative cost and outcomes, where the outcomes are measured in a single natural unit, like life year gained, disease case averted, etc. The output from CEA analysis are usually very important in the NICE decision-making process on whether to form a new intervention to be used in NHS. This is an extended form of economic analysis and is generally used for NICE decision-making and HTA process. The second one, which is more like cost effectiveness analysis, is known as cost utility analysis. It's a specific type of cost effectiveness analysis, which form of comparative economic analysis that evaluates 2 or more policy alternatives in terms of the relative cost and outcome, where the outcomes are expressed by a generic measures of health status that considers both the effect on mortality and morbidity, like the QALYs and DALYs, disability adjusted life year. The third one is cost benefit analysis, which is what we do to gain the cost benefit of an intervention, or mainly the Oxford Academic Health Science Network works around. So the cost benefit analysis is a form of comparative economic analysis that evaluates 2 or more policy alternatives in terms of the relative cost and outcomes, where both the cost and outcomes are expressed in the monetary terms. In principle, it should value the intervention relevant costs and outcomes based on the performance of those affected, like the individual's willingness to pay. While cost benefit analysis have many theoretical attractions for health economists, they are unlikely to be frequent encountered in the medical literature. So it's mainly when you do for like a business case purpose, but not in academia or, in theory, basically. One of the most famous economic analysis or health economics these days people do is budget impact analysis or budget impact model, known as BIA. So budget impact analysis is an economic assessment that estimates the financial consequence of adopting a new intervention. It actually tells you like a straight comparison of the proposed technology in the pathway. It tells you what will be the financial cost consequence of adopting that proposed intervention in the pathway. A budget impact analysis is usually performed in addition to a cost effectiveness analysis. The focus of a budget impact analysis is the direct cost of a specific resource needed to put in the intervention into effect, such as supplies, equipment costs, staff costs, resource time. You don't need to collect utility for the quality of life assessment for budget impact model. And that's really handy when you have to do a quick decision making. The classic example of a budget impact analysis would be a cost provider for a telephone follow-up when compared to a face-to-face appointment for any patient area. Applications and considerations. Why health economics study is applied? Why do you want to do this? So health economics is an applied field of study that examines and finds system-based solutions to make healthcare more equitable, accessible, and affordable for all. Health economics seeks to understand the role that a broad range of stakeholders, such as healthcare providers, patients, and all the public organizations actually play in the healthcare spending. A health economics study examines how to make the healthcare more equitable, accessible, and affordable for all. This is the main 3 point to be considered when you do a health economic analysis. Considerations for technology value. Whenever you want to propose a new technology or you want to assess its effectiveness, what are the main considerations you should consider for the technology? First, how many people could the proposed technology benefit? How much would the technology cost per patient treated? I mean, what is the population you're targeting? That should be a very, very important question. And if the technology has the potential to deliver the benefit, such as allowing patients to be treated more rapidly, it can save the clinician's time or allow a service to be delivered in primary care instead of secondary care. It saves hospital beds or save the patient admissions or, maybe help with early discharge. These things have to be considered. What existing treatment or intervention exists for the conditions the technology might target? Is there something which is already happening? For example, if you're considering a point of care test, would it be better in terms of result than the lab test that's happening in the current pathway? Will it provide the result quicker, which can help the treatment decisions quick? Considerations for patients' benefit. That's really important when you want to do a health economics. Does the technology have the potential to improve the patient's outcome, curing or monitoring? And if so, what proportion? Will it help the patient 10% benefit on the monitoring, or 5% or 3%? These are the considerations for patient. Who's the population? How much population is going to benefit out of it? If it is treatment, how long will it extend the patient life? Will it actually help the patient, have a better quality of life? Will it actually add to patient's life? And how will it affect the patient's quality of life? For example, will it help live a better life in any kind, Benefits and cost. These are two important points to take into considerations when you are planning to do any health economic study. Benefits. Now, in order to transform the intended outcome of a service, intervention, or project into economic, health, or social impact, each outcome needs to be first identified as benefit and then monetized where possible. There are a number of different types of benefits, you can you can get by doing a health economic study, like NHS cash leasing benefit that provides immediate cashable savings to a provider, like reduction in medical equipment purchase or decommissioning of service. You don't need lots of tests, so you don't need to purchase lots of equipment. If you provide something like an easy access or maybe multiple biomarker kind of a test, you don't need to do 10 tests, you don't need to buy 10 equipment. Non-cash leasing benefits, like benefits that help reduce the demand and strain on services, but for which a fiscal value cannot be realized without the decommissioning of service, like reduction in appointments, saving clinicians and the health professionals' time. For example, AI solution these days, they can help you with reduction in appointment by actually delivering the patient's record to the clinicians, and they don't need to come and see patients every 3 months if not needed, the patient are doing well. Or they don't need to come and see the patient after every diagnostic test, because the result can be discussed online. So you can produce reduction in appointments. You can save clinicians time by not doing face-to-face appointment. Social quality adjusted life is a very important benefit. Benefits that relate to the quality of life. Example for being relating to QALYs, maybe improvement in quality of life of patients from avoiding any amputation due to early treatment, improvement in quality of life of a patient by early diagnosis and patient management. For example, if you can identify a patient early, you can treat them early, and that will help patients' quality of life. One of the important benefits nowadays is environmental. You can call sustainability, or nowadays it's net zero, which NHS want to achieve. This can be obtained by reduction in carbon emission and reduction in toxic disposal. I mean, if you reduce the appointments, number of appointments with the hospital, you can reduce the carbon emission by patients not traveling to hospitals. Less traffic, people are coming to hospitals. You don't need carer to go to the patient's home and then bring them to hospital. So actually that does help with the carbon emission. Reduction in toxic disposal, if you're not doing multiple tests, you're actually disposing less of the items needed for the test. Cost. All-in-court cost as a direct result should be considered, as well as potential indirect impacts on the healthcare system should also be considered. Cost of the projected team, implementation, equipments, training, as well as retraining or technical fault should be understood when conducting a health economic analysis. Direct costs are very important. For example, for a point of care test, the cost of the point of care test, the cost of the consumables, the cost of the device, the cost of the resources using it. And it's always advised to actually consider some of the indirect cost also, which actually gives you a clearer picture of the complete cost of that particular technology or intervention. You should always think who or what will be your baseline or comparator. When conducting a health economic evaluation, the solution or intervention should be assessed against a comparator. You need something to compare at. This service can be provided before the intervention or the service running in parallel without the solution. That is the current standard of care. So whatever is, if you're proposing a technology, you should know what you're comparing it against, and that would be your comparator. Funding is the most important thing when you want to consider doing a health economic analysis. This funding, what I'm talking about, is exclusively about Oxford Academic Health Science Network. So how do we actually fund our health economics work here? The company or the innovators can apply for government grant awards, and Oxford AHSN supports them as grant application writing as co-applicants. And once the grant is awarded, the work package that was agreed as in health economics, we work on them and we produce a report. Other way of funding could be the company or the innovators. They always allocate a health economics fund because they want to know the cost effectiveness of that technology, the cost benefit of implementing that new intervention in the pathway. So they always keep some fund aside. The third thing, which is not mentioned here, is that at Oxford Academic Health Science Network, because we are funded by Office of Life Science, we do help new innovators also on health economic study as part of Office of Life Science project. Now, the NIHR, the grant government funding body, states that the research grant application is a sales pitch. This is when you're writing a grant for any innovation or any technology, which is aimed at convincing a particular funder that idea is important enough for them and suggest that approach is good enough and can achieve good value for money successfully delivered by a team of experts. When they say team of experts, they are the technical people who have developing the innovation, the people who will be conducting the evaluation, people like us who will conduct the health economics, the clinicians, the PPI, they all are called as a team of experts. Different program requires highlighting different economic arguments in support of the proposed study. Everybody is important, and everybody's funding is mentioned there, everybody's timeline is mentioned there. Now, the NHR says that cost effectiveness analysis and cost utility analysis are commonly used alongside the RCT, which is a common study design for clinical trials funded by the HTA program. So what they say is that, if you want to do CEA and CUA, that's mainly used when you're connecting an RCT and you want to take it for an HTA program. I4I program is broader and different, has a different perspective, and it can be taken when you're applying. When you're doing an I4I program, when you're applying for an I4I grant, they encourage and provide support for projects which have a strong potential for commercialization and acceptance for use within the NHS. They require a different way of thinking for economic argument to support the proposed study. They mainly like to have economic arguments where you do evaluation with either like budget impact model or budget impact analysis, or you can do cost benefit analysis or early economic evaluation. Now, early economic evaluation, I'm mainly talking about early economic evaluation for medical devices here because Oxford Academic Health Science Network mainly works around medical devices. For the real world evaluation, that could be point of care test, in vitro diagnostics, AI solutions, cloud-based AI solutions. Why health economics evidence is needed for medical devices? Well, evidence is the currency that medical device developers create from the data of clinical and other studies to support the adoption of the product into healthcare. They actually tells you why this device is important and what it can bring as a benefit. Obviously, in terms of cost. The evidence is used by a range of stakeholders determining whether a new device will be marked, paid for by health insurance, and adopted. Regulators need this evidence on the safety and performance and efficacy of that particular medical device. The HTA organizers, payers, and policies makers are interested in the clinical and cost effectiveness of that medical device, whereas clinicians and patients want to know about the competitive effectiveness, ease of use, durability, clinical usefulness, and risk in short term and long term. That's the barrier to adoption of the medical devices. They want to know if the device is user friendly, if it is advised to be used in the hospitals and primary care, or user friendly when it's advised for the patients to be used in their home setting. There are many challenges when conducting economic evaluation for medical devices. Challenges are faced by a medical device developer in producing all the evidence needed for a new device to become widely used in patient care. Their challenges are especially difficult for like SMEs and new developers. The trials are vexed by learning curves and its rapid iteration of device design, adding to the difficulties of choosing appropriate comparator and outcome. Which is the right comparator against it? What are the outcomes you're looking for actually to prove the benefit of that medical device? There are challenges around the life cycle of more devices short. So delaying in getting device to the market will actually reduce the duration of the profitable market and making it non-viable, because there's so much of competition going around these days. If you have an idea, and if you don't, you have to actually move fast from ideation to adoption, or you'll have a competitor coming very soon, which will actually undermine the value of the device. If a new device offers advantage to the patient, there are public health reasons for enabling patient access to minimal delay. If there is some benefit the patient can achieve, then it's better that it's sooner, offered to the patient. And the speed of evidence generation matters because it's a costly process. I mean, from an ideation to adoption for any medical device, it's a very, very costly affair. So the sooner you have the evidence, the better chances of you getting, adopted in NHS and early for a better benefit. To get the evidence early or to have the speed on the evidence generation, early economic model can be really, really helpful. An early economic model is a simple tool to allow the users to gain an understanding of how likely cost-effective proposed alternative under different circumstances would be. Often to the current pathway, we talk about the current pathway that this is what is happening, this is what they're going to propose, this is what will benefit. The most common used to assess the likely cost effectiveness that will be associated with the different tools of clinical trials, evaluations that are planned or in progress. This is the most common pathway we actually take when we do an early economic model. Early health technology assessment is increasingly being used to support health economic evidence developed during the early stage of clinical research. Such early model can be used to inform research and development about the design and the management of new medical technologies to mitigate the risk perceived by the industry and the public sector associated with the market access and reimbursement. So if you have evidence generation and and cost study for a device early, and what are the risks are there for its further development, the sooner the better it is to mitigate the risk, to actually work on the development of that particular technology to have more chances of getting it adopted within the NHS. NIHR suggests that conducting an early stage economic analysis for medical devices may be useful as the companies are under growing pressure to provide the health economic evaluation for their products. Cost effectiveness analysis are commonly undertaken as one-off exercise at the late stage of the development of the technology. However, the advantage of early model is that in future, they may be developed into an advanced economic model used to support formal market activities, including health technology assessment submission. So if you plan for an early economic model at the beginning of your development, You can always turn it into a cost effectiveness analysis later on when you have all the evidence around the technology, you have all the data around the technology. But this will help you in the beginning to actually plan your study better. Now, the Oxford Academic Health Science Network, before we do any early economic study, we actually conduct feasibility study for early evidence generation. Early evidence generation is very important to assess the unmet clinical need, assess the acceptability, perceived usefulness, and explore the barrier to adoption of the proposed intervention before conducting any economic analysis. Sorry. Barrier to adoption is not just about what are the key barriers of that intervention, of the technology or the intervention. It's about how you mitigate them. It's about what are the steps you can take to overcome that barriers and make your intervention work better in the pathway. It tells you, the study actually tells you how the stakeholders going to perceive it. Will they actually be happy using the new technology, or are there any challenges which they think you will encounter later on? Oxford AHSN uses the lean assessment process methodology. The lean assessment process methodology is a developed methodology by Oxford Academic Health Science Network in conjunction with Imperial College. This particular methodology actually supports the decision support tools, digital and artificial intelligence solutions, and medical devices. The lab methodology has enabled collaborations between NHS, academia, and industry to develop products that are more aligned with the needs of the NHS, thus reducing the time to the market. Lab methodology focuses on generating an understanding of the potential benefit and acceptance of an innovation to facilitate adoption by the NHS. What we do here, we actually conduct the feasibility study by stakeholder identification and engagement, which plays a central role. It underpins the identification of unmet clinical need. Where possible, early economic modeling quantifies the potential value of the healthcare system. So before you plan a value proposition, we actually suggest that first do a feasibility study, which will actually tell you the importance of your technology in the pathway. It tells you if the stakeholders is going to perceive the technology, if they can see that the technology has some kind of usefulness and they will accept it in future. Based on that, conduct an early economic evaluation, which actually tells you the early cost assessment. It will tell you how likely this technology is gonna be cost effective in future when implemented in the pathway. And based on that, you can prepare a case study presented, for the further development. Now, the feasibility study for early evidence generation will provide you key insights from payers and healthcare professionals that will be obtained. It will be thematically analyzed on the basis of the route to market adoption strategy report. It also includes key elements that needs to be considered when designing a trial or a real world evaluation. The study actually helps providing a list of parameters that could be used to indicate a health economics data required for early economic model or budget impact model or cost benefit analysis, and the potential benefit of proposed intervention. Basically, the feasibility study will also help you designing your real world evaluation, because it will tell you who are the key people you can engage with when you're conducting a real world evaluation or a trial. What are the main points you should consider when doing a data collection. For the early economic evaluation will also help you actually by giving you idea about what data you need for actually cost effectiveness analysis later on in your project. What are the important factors you should consider? What is the important population you should consider? Who are the main people you should consider when you talk for your NHS adoption in future? Who are the main stakeholders you need to talk to or engage with? There is no one size fit for all solution for a complex decision making acquired. So at Oxford AHSN, we believe that early health technology assessment should be considered an essential stage of product development for all the healthcare innovations. Early evidence generation on product usability and cost effectiveness can not only reduce the commercial risk, but also guide the product to be adapted and adopted by NHS in future. Now, if I have any questions, I'm happy to take. I'm happy to take any questions if you put in the chat box. Sorry, I can't